Turning 65 brings excitement, but also a massive pile of confusing mail. If you're feeling overwhelmed by all the conflicting Medicare information arriving at your door, you aren't alone. I'm here to help. At Medi65, we are your guide to sort through the noise and make this process simple. We've helped countless people navigate this transition, and we even laid out all the facts in this guide to Medicare and retirement planning. The easiest way to understand Medicare is to think of it exactly like building a house. Every part of the program plays a specific role in constructing a safe, sturdy home for your future. Before you can make the right choices to protect your hard-earned retirement savings, you have to understand the foundation you're building on. That foundation is Original Medicare. You get that familiar red, white, and blue card, and it serves as the mandatory base for your entire healthcare house. Think of Medicare Part A as your concrete slab. This is your hospital coverage, stepping in if you ever need an inpatient hospital stay. Then you have Medicare Part B. These are your wooden structural frames holding the walls up. Part B is your outpatient and doctor coverage. Having that foundation and framing is a great start. But here is the catch. Original Medicare only covers about 80% of your medical bills. That leaves you responsible for the remaining 20%. And the trap is, there is no cap, no limit. If you have a massive medical bill, 20% of that cost can be devastating, letting financial storms pour right into your savings. Original Medicare gets your house off the ground, but leaving it like that means you are entirely exposed to the elements. To be truly safe, you have to add walls and a roof. Once your foundation is poured, you reach a fork in the road. You have to choose between two entirely different blueprints to finish building your house. Those two blueprints are a Medicare Supplement Plan or a Medicare Advantage Plan. I want to be clear right now, neither of these blueprints is universally right or wrong. The best choice depends strictly on your personal lifestyle, your health needs, and your budget. The only way to confidently make the right choice and avoid an expensive mistake is to understand how each of these blueprints actually works. Let's look at the first blueprint, a Medicare Supplement Plan. This is the most comprehensive way to finish your house. A supplement acts as secondary insurance. It steps in right behind Original Medicare and acts like solid brick walls, completely blocking out that dangerous 20% financial exposure we just talked about. Because you have those strong walls in place, you get ultimate freedom. You can see any doctor or visit any hospital in the United States as long as they accept Medicare. There are no network restrictions holding you back. The trade-off for this peace of mind is the cost. You will pay a higher but very predictable monthly premium to maintain these solid walls. There is one final piece to this specific blueprint. To keep your home fully protected, you have to purchase a separate roof. In Medicare, that roof is a standalone prescription drug plan, also known as Part D. If you want maximum freedom, comprehensive coverage, and are comfortable paying a higher monthly premium to get it, the Medicare Supplement Blueprint is likely for you. Now let's look at the alternative blueprint, the Medicare Advantage Plan. This functions entirely differently from a supplement. Instead of building your walls and roof separately, a Medicare Advantage Plan drops a fully assembled, modern smart home right onto your foundation. It bundles your hospital care, doctor visits, and your prescription drugs all into one single unit. The major financial appeal of this pre-packaged home is that these plans often come with an extremely low or even $0 monthly premium. On top of those premium savings, they frequently include extra perks that Original Medicare doesn't cover, like dental care, vision benefits, and even gym memberships. But there are trade-offs here too. This is a managed care network. That means you are required to use their specific doctors and hospitals. And instead of paying a high premium up front, you pay out-of-pocket copays as you go, until you hit a set maximum limit. So Medicare Advantage plans save you money month to month and offer great bonuses, but you trade away some freedom and have to pay out of pocket when you actually get sick. When you look at all the letters, parts A, B, C, and D, it looks like a confusing alphabet soup, but really it's just the foundation, walls, and roof of your healthcare house. Even knowing how these blueprints work, choosing the exact plan that fits your specific doctors and daily medications is still a massive decision. Many people think that hiring a professional to help them choose a plan will cost them extra money. I am happy to tell you that is a complete myth. At Medi65, we operate like your free general contractor. The insurance companies compensate us, which means we will review all your options and help you build the perfect plan at absolutely no cost to you. You understand your blueprints now. There is no reason you have to construct your retirement plan all by yourself. I invite you to take the next safe step in this process by attending one of our completely free, no-pressure educational workshops. You can reserve your spot or schedule a one-on-one Medicare review right now. Just scan the code you see on your screen to get started. If you prefer to type it in, visit local.medicaresavingsonline.com/seminar-1. Thank you so much for your time today. We look forward to meeting you and helping you protect your retirement.